All right, we're back with another episode of the Shitty Dad podcast. As always, I am Blair, and with me today we've got
Joey.
and our special guest, Bonnie from Science and Humans. Hi, Bonnie.
Hello.
Thanks for joining us for our podcast. We're pretty excited to get into this topic. It's one that Joey and I are a little bit familiar with. I've been working with you for the last year and a half for my TRT protocol, and it's been going very, very well so far. And Joey's been working with Science and Humans for how long? You been with them for now, Joey?
Just short of a year and a half, too.
Yeah, noticed a lot of improvements, but yeah, why don't you kind of give us a little bit of a background about what Science and Humans is all involved with and kind of how you came to land there?
So, Science and Humans is a hormone replacement platform that you can sign up for online. Um, I joined them about 3 years ago, I think, after some additional training through World Life Medical, something like that. I forget exactly what the education is called, but it's a training program out of the States that deals with hormone replacement therapy, primarily with males, but they also do some of the education for our female side of things as well. And through Science and Humans, we offer hormone replacement for both males and females. And then there's additional programs that you can do, like weight loss. You can do human growth hormone as well. Um, and then they're expanding as well into things like PCOS, PMDD, all female fertility type issues as well.
Nice, nice. So it's kind of one-stop shop for all of our hormone therapy needs. Now, I also, I think when I was talking to Roxanne the other day on my nutrition call, she did mention that Science and Humans is starting to touch on some of the peptide therapy too. I think you can get BPC 157 in a cream.
I believe so. So they're doing some additional education around that right now. And so that should be part of the treatment protocol very shortly.
Right on. Well, that's exciting
Oh, good.
because the whole peptide world is blowing up more and more by the day. It seems like every time I log on Facebook or Instagram, it's popping up in my feed. Someone else is retailing practice peptides. So it'd
Research.
be good to get them through a reputable health facility and kind of have that monitored and you know what you're getting compounded and what you can expect with the protocols, right? So
Absolutely.
right on. So we kind of tripped through and thought about this a little bit over kind of the questions we had when we started in with our whole hormone therapy protocols with Science and Humans. Maybe we'll just kind of start here. So why do you feel that so many men over 30 are just like unmotivated, anxious, and not themselves? And they just find everything is so difficult these days. Do you find that's like one of the key markers you're noticing when you get into hormone therapy?
Absolutely. We see that a lot. And it's not necessarily just that age group. I think we're seeing it younger and younger. And it's essentially just stress, right? There's way more stress on people these days, men and women. And when we have these big stress responses, that basically robs our testosterone, robs hormones in general. And that's the whole piece with cortisol and that type of thing as well. And so we're seeing not necessarily are people unmotivated. It's that we have this huge stress response going on all the time. And people are overwhelmed. There's so many pressures, day-to-day lifestyle pressures, those kinds of things, and that contributes to that high cortisol. The body wants to deal with stress over reproduce, right? That's what we're geared to do. And so that's why we see that. That's why we see lower testosterone numbers as a whole.
Mhm. So kind of, I guess one thing we should touch on is that what is our baseline for, like, say, free testosterone? Like, what levels do you typically see, and what does good look like?
It's different for everybody. Like, we have an ideal range, obviously, and that's the whole thing about looking good on paper versus optimum health. So in terms of uh, total T is usually the number that we look at the most initially, especially. So total T, anything between 8 and 35 is considered normal for all men ages 18 to 80, right? So as somebody who's 35, what's your ideal number? It depends on what your baseline is and what your optimum is. What do you want to
Mhm,
get out of it? So, usually when we talk about titrating doses and those kinds of things, I won't necessarily say that we have a target number in mind for the total testosterone or for the free T, but we definitely do have, your goals in mind. What do you want to achieve? Do you want to, have more energy, better libido, better motivation, better mood, sleep better, all of
mhm.
those kinds of things. That's what we're looking at, and that's what we're shooting for more than lab values.
Okay. And because I would imagine that there's lots of guys who come in and they're feeling really flat and low, and mm, they could take a very minimal dose and see significant improvements, like, really fast. Um, I know for me, like, I came in on the other end of the spectrum where I was gray market labs and taking care of this on my own for years and years. And it was just time to make that transition into, being on a prescription, being monitored by a medical professional. And I've learned an awful lot since I've gone down that road. Now, I'm not taking near as much testosterone as I was before, probably half a week compared to what
Mhm.
I was before. But I can tell you that I haven't lost any size or anything like that. And I've noticed a lot of actual improvements overall with how I feel. And the one thing is, too, is like you guys take such a holistic approach on the blood panel. Like, my physician wouldn't normally go into that much detail on my blood panel and like get into all that. So, what are kind of some of the other markers you would look for on a client's blood panel that you might have to go into maybe some supplementation and other things like that too, besides just the testosterone?
So when we look at the blood work, initially we're looking at the complete blood count, the hemoglobin hematocrit part of it, to make sure because that has to be within the normal range to make sure that your blood essentially doesn't get too thick, right? And so when we start you on testosterone therapy, that will bump up your red blood cells, which will also bump up your hemoglobin and hematocrit. So if you think about it, your heart's pumping syrup instead of water, basically. And so that can have negative side effects. So we want to make sure that we look at the hemoglobin and hematocrit really closely for your blood work. We look at your creatinine, we look at your glomerular filtration rate for your kidneys. The creatinine will always go up if you're taking a creatine supplement. And so we can tell, hydration status, those types of things from that. And we can also tell, you know, if you're taking creatine and if you're actually absorbing that creatine. We look at your iron. So ferritin is a big one, especially with um, that stamina and even sleep and feeling restless or not recovering the same. When we look at your ferritin, we can say, okay, you're on that lower end of normal, whatever normal tends to be for people. We have an ideal number kind of that generally we want you to stay above 100, and so we tend to promote iron rich food supplementation in that way for iron specifically because of the benefits obviously. We look at things like the estrogen as well, because whenever we start you on that testosterone therapy, some of that testosterone converts into estrogen. So we have to, that's when you get those negative side effects, man boobs, acne, like water retention, sensitive nipples, loss of erections, low libido, all of that stuff generally comes with higher estrogen. And, you know, feeling overly emotional, that type of stuff. And so we want to make sure that we're controlling that as well. We use estrogen blockers versus supplementation for that most of the time. I do have some guys that don't tolerate the estrogen blockers as well, and so they will use supplements to try and bring down that estrogen as well. But we tend to just use estrogen blockers.
Uh, Gotcha. I do take that, like a quarter of a pill a day.
And if you
So or
didn't,
not
then
a
you
day,
would,
after my shot.
yeah, if you didn't, you would probably, cry at the commercials and stuff, right?
Stop taking it. I want to see it.
We don't want that.
Yeah, you wanna see me cry? We'll watch Bambi or something?
One thing I want to touch on that Blair had mentioned about, people I've heard say that they don't want to start TRT because they feel they're anxious enough, and they've heard that starting it will drive the anxiety higher. Is there any correlation to that, or is it better for people who might be more anxious than average?
It is actually. So generally, the anxiety piece comes from having higher estrogen. And so when we control that estrogen and bring up that testosterone and get that ideal ratio between total testosterone and estrogen, we tend to see a significant reduction in anxiety. It's mood as a whole improves, and so um, that that's a myth, right? So part of that is your gym bros that are taking crazy amounts of testosterone and then not controlling that estrogen as well. And that's where you hear about things like the roid rage and those kinds of things. But that's not in a controlled setting, doing these blood work regularly, that type of thing.
Mhm. Yeah, and that's the one thing, I guess the other the other thing we wanna touch on too is, like, we're strictly dealing with testosterone, we're not dealing with anabolics and other muscle enhancing drugs. So you guys are strictly in the realm of TRT is testosterone replacement therapy. You did say you can get growth hormone, though.
You can. I specifically do not prescribe that. We only have like a few of our prescribers that are educated in HGH, and so they are the ones. It's the same process. So you would do the intake form. There's a different panel of blood work that you do as well, and then it's evaluated, and you get that same. You are eligible for HGH or you are not eligible for HGH, and it depends on things like your insulin, your blood sugar. There's a couple. They do your HGH level, so there's a couple different things that they look at as well.
So is that more or less just for people who are suffering from like muscle wasting or just like can't put on any size or what kind of is the wheelhouse where we would get into that?
Truthfully, like, because I don't prescribe it, Blair, like, I don't tend to have, I don't do any research on it or anything like that, so I couldn't
Okay.
fully answer that question for you.
That's fair. Maybe we'll talk to someone else or in your office about that.
You definitely can.
I'm feeling really small. So
No, you're not.
I could get some of that.
Right
No,
after
that's
you
all.
do your blood work again. Yeah.
Yes, exactly. You have to do more blood work. So what do you find are kind of like the most common factors that you see in repetition with guys who are having their first appointment with you? Do you find like most of them are coming in, like Joey said, with a lot of anxiety, or a lot of guys just like apprehensive around this, or
I
like
feel like
almost embarrassed, maybe? Like I find a lot of guys that I've talked to, like it seemed like it was a big stigma for a long time. And now when I go and get my blood work, guys like, oh, you're here for your TRT panel. I'm like, oh yeah. So it's kind of losing that a bit, but
I wouldn't say that most guys are anxious. It tends to be, low motivation, w- can't gain muscle, can't lose body fat, struggling with libido. Those are usually the most common symptoms of reasons why we see people. And honestly, I wouldn't say that when most men when they see us, they're they're at that point where they're ready to do whatever it takes just to feel better. right? And so it's not, all shame aside, it doesn't matter because like they've already done the blood work. They know that they're eligible. We're just here to help, right?
Uh-huh.
So that's, I think that helps with that stigma maybe because we don't tend to see a lot of that. Like guys are ready.
Yeah. Well, I guess that's right too, because by the time they get to see you, they've done their blood panel and they know, like, okay, well, I'm eligible for TRT. So obviously my hormones are out of whack and we got to do something to address it. Right. So
I
what
think a
else?
key to
We got a lot of questions, but I don't want to just sit here and ramble. So,
I I think a big thing, especially for me, was when I met Blair and he told me about it was finding a source that is legitimate, right? I mean, you throw it in Google, and I mean, good luck, right? Um, so that's what I found was unique to. I had someone who's gone through it, but then um, learning about you guys and being able to reach out to people. Um, and that's one thing I find Science and Humans does really good is your guys' response times to inquiries or emails, or even once you're in the program, being able to talk to somebody if something's changing during your your testing phases. I think is um, it's super helpful with you guys. Like that's why it's kept me a customer coming back and yeah, it was like, wow, this is a legit source because you look everywhere and you just don't know what you're getting, right?
Yeah, absolutely. Oh, that's good to hear as well. That's good feedback for our admin team for sure.
yeah, no, it's it's been like night and day, like I said, for me personally, like totally is not near as much junk in my body, putting in vetted, clean compounds and like legit less than half of what I was using before and still stellar results, right? So I've got zero complaints. Um, now, where was I jumping into? So we kind of touched on it earlier, and you said like you're seeing younger and younger. So kind of, do you have an average age that you guys generally work with, or is it it's just so all over the map now because of how the world is working these days and everyone's test is dropping off the roof?
It honestly is a massive range. I couldn't tell you truthfully what our average is, but I would say the majority of our patients fall between 35 to 55 very
Mm,
easily, right?
yeah.
And then we do have the outliers that are mid 20s to late 20s and then obviously above 55 as well. I think my youngest patient that I saw was I believe 22 and then my oldest patient that I've seen I think is 76.
Oh,
So, like, the
fountain of
range.
youth.
Yeah,
That's awesome. But it's a good way to stay feeling energized and full of vitality, right? So,
and the goal there was just muscle mass retention, right? Just to
yeah.
keep that and make sure that the bones stay healthy, those kinds of things, and, I mean, not necessarily performance, but,
Uh-huh.
definitely to maintain that, strength throughout.
Yeah, for sure. So, so with the testosterone replacement therapy, does that play kind of a role in maintaining bone mass as well, like as we age?
Just because your muscle mass maintains that bone mass as well.
Mm,
Yeah,
okay.
yeah.
Yeah. Gotcha.
What do you think? And this was kind of the process I struggled with in the beginning is why do you think traditional, maybe I don't know, traditional medicine is the right word, or the traditional family doctor is so hesitant? I've heard in some cases other people dismissive of even looking into this for their patients.
I think it's, part of that is just not it's not technically a disease. We're not diagnosing anything that's technically wrong with you because on paper you fall in that normal range, right? If you're between 8 and 35 for a male, that's the normal total T, so that's considered okay, but it's not optimum. And that's what we're looking for, right? Based on your symptoms, based on what your blood work shows, that's what we're looking to get that total testosterone up to. And so traditional the medical system, I guess, as a whole, uh, if we're not treating something chronically wrong, then that it's not worth treating, kind of thing, because it's about disease management versus optimum performance, feeling your best, right?
Mhm.
So that's where this the whole market for uh, wellness and that realm essentially comes in.
Okay.
Gotcha. Do you find like you have quite a few patients who come in who kind of getting back into the whole like anxiety, depression state, that are on a lot of other medications when they arrive that are able to like back off of those as
Yeah,
they switch their protocol?
yeah, absolutely. So oftentimes it'll be that your patient has gone to their primary care provider and they've been diagnosed with depression and anxiety and started
Mhm.
on the usual medications for that. Um, they don't notice a huge improvement or they feel like there's too many side effects. And so they're looking for other reasons or other potential therapies that they can explore to feel better. And so that's oftentimes when we see them reaching out for, testosterone testing or hormone testing in general. And then we find that, it maybe is on that lower end of normal. And so we can help with that. And so we have had quite a few patients that will, um, I've never felt this good. I'm going to try and taper off of my antidepressants slash anti-anxiety medications. And that's pretty common, truthfully. I mean, there's some that will always be on antidepressants or anti-anxiety medications, and that's okay as well. But there's a lot that, especially when they've been diagnosed with that after a significant stressful life event, kids, divorce, death of parents, death of friends, those types of things, then it's generally cortisol slash testosterone related. And so then when they're started on those types of medications, they don't necessarily get the effect that they're looking for. And that's why they come through to looking for hormone replacement therapy.
Awesome. What kind of other suggestions would you have as far as cortisol management? Because like that seems to be flaring up for another one I get on my feed all the time is like, do this test and discover your cortisol issues and how you can figure it out. I don't trust that shit. So I'd rather just ask a professional. So
With it for cortisol, so when we look at your blood work, I for TRT, we don't actually test your cortisol. We don't look at your DHEA either. And so when we do look specifically at stress stuff, we can add it to your panel at times, depending on, the rationale. We can look at DHEA, and DHEA is essentially the precursor for both testosterone and estrogen. We do see I some people that will say, "Hey, I'd really like to get my cortisol tested." Blood cortisol is not as gold standard as is saliva cortisol
mm,
testing, and so and that test is through private lab, not covered by provincial health care, and so you pay. I think it's around $450 to get this. They send you vials, you spit in them 4 times a day for 3 days, and send it into that lab, and then they'll send you your results. Uh, Cortisol is a huge deal for um, like what your testosterone numbers end up being, and so both cortisol and testosterone share the same precursors essentially. And again, as I mentioned earlier, it's just that your body is going to deal with stress before it's going to think about fertility, right? It's going to think about survival versus growth. And that's essentially the difference between the testosterone and cortisol and what your body's going to support.
gotcha. Okay. So I got to spit in some vials if I want to get a real test and not just answer some questions online.
Well, yeah.
Right
Yeah.
on. Oh, that's good.
With the patients you've seen, what is, I guess let's go back to it. with the patients you see for the first time after they've done their 3 months, what would you say is the number one thing that everyone will say they found has improved? Whether it's energy, libido, size, weight loss. What's the most common thing?
Almost always it's energy and mood. Those are the 2 things that tend to be the first 2 things that people notice. Um, eh, Libido comes a little bit later, and that's almost always a focus as well. But, what happens is if we only do testosterone therapy initially, your own testicles essentially turn off, right? Because the testosterone therapy, it replaces what your body produces naturally, and your testicles work on supply and demand. When your testicles don't have that signal that they need to create testosterone, they turn off. And then we'll see this kind of, they felt amazing until about that 8-week mark, sometimes 8 to 10, and then they'll notice a bit of a decline. And so that tends to always, if it's not really well explained in the initial appointment, that tends to always be a bit of a shock for some. And then we get to that 12-week mark where there's been a little bit of recovery from that kind of slump, but still not as good as they felt at around that 6 to 8 week mark. And it's, you know, some guys will say that it's their mood. Some guys will say they just sleep way better. Um, Energy is always a big thing. And then stamina at the gym is usually like I can do more reps and I can do this and this. I haven't seen any changes, but I can feel like I'm able to do more.
Uh-huh.
Yeah.
So,
Um,
oh, go
that
ahead.
is a question that someone's asked me and I didn't have the answer. Was they again heard and they were concerned that if they supplemented now with testosterone, that say in a year, 2 years, where they're just like, I'm good, I'm off of it, that their body will not be able to produce anymore, or they'll always be chasing the testosterone therapy for the rest of their life. Is there any truth to that? Or
So, I mean, what you're if we're doing optimum health things like sleeping really well, having good nutrition, working out regularly, and those testosterone levels are still on that lower end of normal, that's your baseline. That's what your testicles can do, right?
Uh-huh.
So even if we're supporting them, making sure that the cortisol is not taking away from that testosterone production, that type of thing, that's your baseline. That's your what you're going to get. When we put you on that testosterone therapy, it does turn off those testicles if we don't use things like HCG or human chorionic gonadotropin to maintain that fertility. It will turn off those testicles. And then if they decide to stop using testosterone therapy in the future, your own testicles will kick back in. It does take a bit, and we can speed that up using things like HCG, Clomid, those kinds of things. But it's only going to go back to baseline or a little bit less because we've had that chronological time of aging as well, right? We can't delay that, and over time they will produce less. So they'll catch back up to the baseline of what it was prior, but it's not going to be um, you know, the same as when you're on TRT.
Uh-huh.
gotcha.
So,
And we
like,
can
is it a lifelong thing? It depends on what you want. If you want to feel that way for a really long time, then it could potentially be, for
uh-huh.
sure.
Well, and I think it's like Joey and I kind of talked about this last episode when we knew you were coming in, and it's like you can do all the hormone therapy you want, but if you're not getting exercise, getting sleep, proper supplementation and nutrition, it's kind of useless anyways. Like you're going to see an uplift to a degree, but
Mhm.
it's not going to change your world. And it's the same thing if you are going to be like, well, I'm going to come off TRT because I don't want to do it anymore or whatever your reason might be for that. I don't know why you would, but say you're going to come off, unless you're living an optimal lifestyle, you're going to see a massive crash compared to being on TRT therapy. And so, yeah, like I think it's just one of those things. Like it's always had a stigma for so long because it's on steroids, steroids. It's not steroids. It's testosterone replacement therapy. It's not. running a bunch of D-ball and Anavar and clanking weights like Ronnie Coleman and Arnie Schwarzenegger back in the day, right? So, no, it's a big thing. What about like the guys that are scared of testicular atrophy?
We can manage that as well. So if there's any shrinkage at all, we can always start HCG, or pregnal is the other name for it, and that will stimulate those testicles to actually, produce at least a little bit of testosterone. And when they start to work again, that's when you get the size back. It's like anything. If you don't use it, you lose it, kind of thing. That's the same idea with the testicles. And then when they start to do their job again, then they'll return to normal size.
Okay. Might notice a little shrinkage there, Joy.
Well,
Ah.
I think that's one thing that my brother said. He's like, when he found out, he's like, "Oh, hope you enjoy your tiny balls." I'm like, "Yeah, that's what it is."
Mhm. Yeah. Yeah.
Yeah,
We can fix that.
I didn't know that. That's pretty cool.
Bonnie
What
has a
if
solution for everything.
what if I just was like, I wanted like a big set? Could you still just like, what if I lied about the entire thing? Like, do you do you like? Because now I'm curious. Like, do you test for it? Do you send me a device to measure it? Like, how do you guys? If I'm just like, I need bigger ones. These aren't the same ones that I came to you with. Are you guys like, here, just do this? Like, or is this all through testing again?
We do not measure. We take your word.
Well, I would measure, and then I would be like, hey, this was my baseline.
Yeah. They went from golf balls to almonds.
Yeah.
Let's get back to like
So this is
marshmallows.
all honor system.
It is. It is. It is on the honor system. And like
Excellent.
it would, so fertility as well, right? So some guys are really
Right.
worried about fertility. And so they don't want to start testosterone therapy because it can impact the fertility. And that's
Mhm.
when we notice that, right? So if they have big shrinkage of their testicles, then we for sure know that it could impact their fertility. And so we just make sure that anybody that's in that, uh, you know, phase of their life, that we can support them with that pregnol and make sure.
Okay, so this is where I screwed up. Is I believe when I went on the website, I believe the way it's laid out, there's different. There's either like TRT or there's something for fertility,
Yeah,
an
HCG.
option.
Yep,
And which I think I went to that one, and then, like, I had already been fixed years prior.
yep.
So when I went to it, my initial one was like, "Oh, you're not eligible." And I was like, "What?" Like, I okay. Then it was like 20 minutes later, you guys actually called me and said, "We think you signed up for the wrong thing. You're eligible for testosterone if you'd like." And I was like, "Yes." So you got to keep that in mind when you go to your website and do that.
That
But
is
I
true.
guess that leads into a question with mine. So, is there any differences between men who've had a vasectomy versus men who don't when it comes to testing or testosterone paths with you guys? Is there different things or
The only thing that is that we don't have to worry about your fertility because you're not worried about your fertility anymore, right? So that when if you came, if I was the initial person that saw you and we started talking about TRT, I wouldn't necessarily address the fertility question because you've already looked after that. Anybody
Mhm.
that's in that age range and has not had a vasectomy and they like don't disclose that they want to have kids, that's a question. It's always a discussion. Is that something that you're looking for in the future? What's our timeline look like? That type of thing. And if it's anything like short term, then we would start on HCG instead of starting on TRT.
Gotcha. That makes sense.
Because basically, what it does is just stimulates your testicles to do their job better, right?
Mhm.
More efficiently. And so, the goal behind that is to bring up the testosterone through that.
Yeah. So
okay?
now the next question that kind of came up when we were talking with the fellas was, do you get a lot of feedback around like my wife says this, my wife says this, like my wife says I'm too horny all the time now, or my wife says I'm a happier person now, or do you guys survey the wives?
We do not, but we do hear it that way. So we hear lots of my wife says I'm way happier. I'm
Mhm.
less irritable. I'm easier to get to do things. I'm more motivated.
Yeah.
I've started looking after myself again. Those types
Oh,
of
good.
things.
Yeah.
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 But we don't survey the wives. I have had wives that have sat in on appointments to give me their perspective.
Yeah. They're happy
Uh,
wives.
Yeah.
Well,
Yep.
that's good.
Usually it's because they think that their husband doesn't share everything and so they want to share. So,
Oh, well, that's yeah, that's a good one. That's a good
yeah.
one. Like I could see that because a lot of men downplay their health issues, right? And I know like that was a big one with my wife. She's like, "Why do you have to go and donate blood like every 2 months now?" I'm like, "Because I have to because Bonnie says my hemoglobin is too high and I have to get this done." So and like that's a concern, right? Where it's a perfectly normal thing. It happened. I'm like, mine's not even that high. I don't think it was like 174 or something like that. I think like the top end's like 170.
Yeah, 175 usually. I probably just said your top end of normal. Yeah.
Yeah, I think that started to come up in my last 2 tests. I know the first one, and this was actually I wanna bring it was actually really cool too, is I took the one in the summer. Remember in August, I got my blood test or just before September long, we were out at the lake,
Uh-huh.
and I just got it done, and I went out, and then you guys had actually called me, and I there's a marker in it that if you're sick, and I think it starts with a G, it's really down. So there was something super alarming enough in my blood work that you guys had called me and she's like, "Hey, like, uh, I wish I could remember the fancy word term, but I don't even remember what I ate tonight." Whatever the word was, she's like, "We're really concerned. It's very, very low. We think you should see a doctor. Is something happened in the last little bit?" I was like, "I was the sickest I've been this last week in a year or 2. Like I didn't hydrate, I didn't go to the gym, I didn't do anything. I was stuffy, I was blah 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 blah." She's like, "That makes sense." She goes, "As long as you can confirm that, you weren't in the best health that you've been." She goes, "This is why whatever that marker is super low," which I thought was great because I literally did, I think, blood work on a Thursday. And then it was Friday afternoon. You guys had called me with a result and was like, "Hold on, we need to call you and let you know." And I was like, "Oh my God, that's awesome." But I'm okay. And then now, with that was the first time that I think when my hemoglobin was up, and then we had talked about that, which he's like, "Okay, well, maybe it was because you were so dehydrated the week before." And then it got better in the last one, which he's like, I think this one that's coming up, she's mentioned that again, the blood donation, might be an option. So is that common, the longer that you go on testosterone?
It Everybody kind of responds a little bit differently. So we have some guys that no matter what, like we barely start them and then they're donating blood and it's a regular thing. And then the next guy, it's like once a year. That's all that he needs to do. And that brings that hemoglobin and hematocrit down and it takes him that long to build it back up. So it just depends how your body responds. I have other guys that their total T stays nice and high and they never donate. It's just not a thing for them. They don't see that red blood cell count raise at all. They don't see their hemoglobin and hematocrit go up at all. So it depends how your body's going to respond to that testosterone therapy. Yeah.
So let's
Okay.
let's talk about needles because
I hated them.
there's a lot of guys that are scared of them.
Yeah.
Joey
That was
being
me.
one of them.
Yeah, I can get tattoos, it's fine, but, like, I needles were a no-fly zone for me, but, like, Blair had talked to me and you guys did too against the difference between the cream and the needles and how much better it is on the needles and the cream, but they were both up to me, and I think the first time I told Blair, I literally just stuck the needle on my stomach and just kinda, like, waited and, like, kinda, like I sneezed and then poked it, and I was like, "Oh, not bad." But I would say, like, it took me about a good 6 or 8 months to be comfortable enough with it, but it was nowhere like what I thought. Like, I hated getting blood work done, and this was just something completely different. Still, it was a mind over matter, like, "I'm doing this. I'm stabbing myself," right? Um, but it
Dapping.
really well, that's what it is, right? You're just stabbing yourself in your gut, and it was just that was the mental hurdle, like, "I'm doing this to myself," and it's not a thing anymore, and it really wasn't a thing at the beginning. For someone who hated needles was just like, I don't know if I could do this. Like, I think it was my wife walked by and she called me a baby. She's like, stop being a baby and just do it. I was like, shut up. And you get over it, but it's better than I think blood work in your arm,
Mm.
right? I think
Yeah,
there's more of a pinch in your arm than it is when you do it in your stomach, right?
because you're doing subcutaneous injections, right, Joey? Yeah.
Yeah.
So I guess that's the next thing. So subcutaneous injections versus intramuscular. What do you think? Pros, cons?
I mean, when we compare intramuscular to subcutaneous, technically subcutaneous takes longer to absorb, right? That's the difference. They're on the package of the medications. They'll specify sometimes what it's exactly which one you should do intramuscular, which one you should do subcutaneous, or what you're allowed to do. The Cypionate tends to be a bit easier for the subcutaneous injection. In terms of results, it honestly, I haven't seen a huge difference. It does not, like blood work wise, as long as you're doing it properly, as long as you're doing your timing until your blood work properly, we don't see a huge, massive difference. Um, there are some guys that say that they feel different between the two methods, but that's personal.
Yeah. So
I feel there's a difference between the two. What's the larger one in the clear? The Cypionade?
Yeah. The Cypionate is
And
in
then,
that water-based solution, and then Nthanate is in that oil-based solution.
yeah, I found that the oil base just, I feel like I get more energy out of it. And I don't know if that's calm or what, but and I felt, I better results over that one.
it's 250 milligrams, I think, versus 200 between SIP and Anthony, isn't it, Bonnie?
It's 200 to 100.
200 to
Cypionate is
100.
100 milligrams per mil, and then Nthanate
Yeah.
is 200
Uh-huh.
per mil.
Yeah.
Yeah, so it's always half the volume when you're doing Nthanate, and then that's just been because of shortages, really. Otherwise,
Yeah.
our usual first line is Cypionate.
Okay. Gotcha. So for guys who are doing intramuscular injection, needle size gauge, what do you recommend?
It I mean, ideally to draw up, I like an 18 gauge for anything that I draw up, and then
Uh-huh.
to do the actual IM, you need at least a 1 inch to hit I mean, doesn't matter how skinny you think you are, right? That you need at least a 1 inch to get to any type of muscle. If you're doing it in the glutes or if you're doing it um, in your thighs, it doesn't, you need at least one. So preferably 1.5. And then, a 23 is okay. Um,
Uh-huh.
yeah,
I'm a big baby, so I use 25s.
you can. It's just, you got to think
It's
about it
just a
though, right?
harder push,
Yeah.
right?
So your
Yeah.
PSI coming out of that tiny little needle is a lot
Uh-huh.
higher. And so
Uh-huh.
then it actually hurts more in the muscle side of things because that pressure that goes into your muscle, right? It
Yeah.
just,
You
if you
gotta
have a
really
bigger,
you gotta ease it in there, ease it real slow. Because if you're hammering on that, it can hurt and it can leave a big welt
oh
on
yeah.
your butt or in your thigh, which is not all that fun.
Yeah. I
And
listened to you and did the thigh and numbed my leg for Halloween. That
yeah,
was really cool of you.
yeah. I tell you, thigh I can't even put a needle in my ass anymore. It's so much scar tissue and it doesn't even work, so
And that's the thing about making sure you rotate sites and that type of thing
okay.
because you want to avoid building up scar tissue because that impacts the absorption too.
Yeah. I can hear it crunch when I stick it in the wrong spot in my butt cheek. I'm like, "Ooh, god, it's a bad crunch in there." But, no, it's just one of those things. A lot of guys I've seen a lot of people who were talking about intramuscular versus subcutaneous injections, and, like, I do both, and it's fine. But like you said, I use an 18 gauge to draw, and then I transfer it to then I push it into, like, the insulin needle, and then I can do my subcutaneous injection that way. Because I can imagine, like, I watched a video and this guy's like, so what you need to do is run your bottle under hot water for 3 to 4 minutes and then draw it. And he's drawing it with an insulin pen. I'm like, you'll be there for 2 days. Like, like I don't understand. Like, you'd be there all day trying to suck that all up with the insulin needle. And I'm like, you're going to be forever. So yeah, it's okay to draw with a regular syringe and then transfer it into an
Well,
insulin
I would
needle.
just use a 1 ml syringe right from the start because the only thing about a transfer anywhere is the contamination. You don't
Mhm,
I know it's your own germs dealing with your own skin and that type of thing, but even still, just for risk of,
mhm,
if you use a 1 ml syringe, it's essentially the same size as your insulin. It's the same, diameter, just longer.
mhm. Yeah,
Then you just take the needle off, take your 18 off, put your 25 on, and then do it that way.
and way you go. Bob's your uncle. Then you're getting all the right stuff.
So I guess with like we've touched on what you should do, and who's eligible for it. What are some things that people or men might be going through that you wouldn't recommend um, them to try the testosterone replacement therapy?
Anybody who's, if fertility is a big deal, it wouldn't be testosterone. We would go with the HCG route. And
Mhm,
then usually that's the biggest um, deterrent for TRT specifically. Otherwise, there's if you have blood clotting disorder, uh, testicular cancer, even is we can have that conversation at the very least just to see. But otherwise, there's not massive red flags. It's essentially like we can look at your medical history and make that informed decision with you, so that you know the risks, you know what's going on. But there's some absolutes. Uh, but truthfully, for TRT, it's what your body produces naturally. So it's not something that is, you're not eligible for. It's contraindicated for your your own body because of that. You know what I mean? It's anybody can have it as long as their medical history doesn't contradict it.
gotcha.
And with that, and thinking back from conversations I've had, and this one came from my professor of life, my brother. He mentioned along with, oh, enjoy your tiny balls. He had said also enjoy your prostate cancer and heart failure. And I was like,
Mhm.
again, like if you're taking Chinese bathwater testosterone, maybe, but this isn't the 90s anymore. This isn't, and these are all things that you guys test for and monitor, correct?
Yeah, and the whole thing about, heart issues and that type of thing, it's generally because that hemoglobin and hematocrit has not been controlled, right? So your heart's pumping a lot harder. It's working way harder and your blood is thicker. And so you're more at risk of a blood clot in your heart, your leg, your lungs,
Mhm.
that your brain, that type of thing. And so that's why we monitor those things so closely, and that's why we want you to do blood work every 3 months.
Mhm. Yeah,
What about
that's
prostate?
Prostate, we want you to have your PSA checked, and there is the potential that it can enlarge your prostate. So if your PSA goes high, then we won't do that either. But again, that's within a conversation because your PSA, your prostate specific antigen, that's what PSA stands for. It can go high, like from various different things. It's not the best clinical test in terms of saying what the health is of your prostate. It can go up if you were really constipated, you had recently ejaculated, you rode a bike for a really long time. Like that's you know so the PSA is not a wonderful test to say what the health of your prostate is, but if there is any type of inflammation and there's no good rationale, then we do stop it until you have that checked.
Okay.
so what got you into this, Bonnie? Like, what was the draw for you to get into the world of hormone therapy? And
It was it was an interest. Like I preferred to deal with women mostly, and But then when I looked at opportunities for this, there was a lot of um, male hormone replacement therapy. That was kind of the where most of the online platforms were providing that option. And so I joined with Science and Humans, and the goal was just to learn more and to be able to help as many people as I possibly could to feel better. And I know that our modern medical system, I guess, I we're not geared for that. We're not geared for optimum performance. We're geared to treat what's already wrong. And so it was more of a that whole preventative side of things versus, treating something when it's already too late. So that was my interest, was just that whole wellness realm.
Mhm. What do you think
And
of the enhanced games?
oh God, here we go.
They're coming up. This is
That's why
exciting.
Blair's going to
I'm
get all the stuff from you guys.
yeah.
He's joining. He's
I'm 40. I'm gonna be 43 on Thursday, and I'm gonna go and compete in the enhanced games next year. What do I need? No, I just like what do you think personally? This doesn't have to be your your professional hat on, but like I think it's really cool what they're doing, like enhanced games, full monitoring, full disclosure, under doctor's care. Like we all know that there's been doping in the Olympics for years, but that swimmer looks like a mutant now. Like it's unreal the change he's made since his last Olympic appearance. So he says he's going to beat the world record by a lot.
well, and he probably will, truthfully.
Yeah. Do you think that there's a place for that in sport now?
I'm more of a natural uh, sport enthusiast. That being
Hmm.
said, I mean, I watch baseball. It's my favorite thing in the world. So
Yeah.
it's not so natural, probably. But uh,
Hmm.
I don't know. I don't know.
But I think there's a big difference between testosterone replacement therapy and then the juiced up games. Like they're not just on, you know, testosterone replacement therapy. They're on
Hey,
much more.
testosterone and growth
Right. It's
hormone. Like, hey,
well, I
we're,
don't
we're
know. I
getting
think
there.
it's
And probably monitored, but is it monitored within, what kind of parameters? The parameters that allow that mutation, essentially. You know
Yeah,
what I
I don't
mean?
know. I need to do some more research on it, but I know like from what I read, they said like these guys all have to be assigned to a physician and their panels have to be like it's all basically by like this is what you get. You don't dabble in the other stuff. And
let's
I'm
keep in mind Michael Jackson was under the care of a physician too. And
like yeah, that happened.
right.
We had an oops. We lost
um
we lost MJ. Yeah.
one thing I wanted to I remember now to bring up and I had no idea going into this was it's covered by many people's insurance plans too,
It
which I don't
is.
think anyone knows. Like I had no idea.
Yeah.
Right. And it just was so cheap. And I was like, I didn't know this was a thing. And I think that's can be a big plus for people too.
Most benefit plans will cover it. HCG or Pregnol, sometimes it's a bit hit and miss depending on your benefits. And then if we use anything compounded, because it doesn't have a drug identifier number, those tend not to be covered. But if we use, straight up cypionate, enthanate, that type of thing, or the gels, those are, because they come with a drug identifier number, they're usually covered by benefits.
Yeah. Yeah, no, it's like legit $12 after the insurance covers it. I pay
Right.
more for
That's
shipping.
ideal.
Yeah,
Yeah.
it's good. That's very good. 'Cause, yeah, if it wasn't covered, I don't know what it would cost, and, you know, the gray
It
market's
ain't that bad.
expensive.
No,
Yeah.
it's not that. I think it's even to get it shipped. Um, while I was in between coverages, I think it was like $95.
Oh, shit, that's
And
not
again, I think most of that's all shipping anyways.
mhm. Yeah,
Right.
because
So
we both get it from the, pharmacy in Edmonton, and then they ship it to us. It just seems easy that way. I'm sure I could probably go and pick it up at Shoppers Drug Mart down here or something too, I guess, but
Yeah. Yeah. Science and humans makes it too easy. Like there's
Mhm.
not any reason why you can't,
Yeah,
right? So
yeah, exactly. So if there was 5 things you could recommend to the fellas to adjust in their lifestyle to help promote their natural testosterone before they come and see you, what would those 5 things be?
Sleep would be
Mhm,
a big thing. Make sure that you're getting really top quality sleep hygiene type things, those that type of stuff. Stress management would be another really, really big one. Making sure that, if you are going through a lot of stress, that you're supporting those adrenal glands to keep that cortisol where it needs to be, uh,
mhm,
whether that's through supplementation, um, or just doing the right things to reduce that stress. Uh, Diet, it makes a big difference, right? So when you're not feeding your body well and with good quality stuff, it doesn't operate
mhm.
optimally, sorry. And so that makes a big difference as well. What am I on? 3? Um
Yeah, I'm counting.
yeah. Sleep, nutrition, stress, and then activity. Like you have to move your body, right? If you don't use it, you lose it, and that's probably the biggest thing. Is a lot of guys they'll have been quite athletic throughout high school, college, that kind of thing, and then um, when they start working, it's not the same level of activity. Like golfing once a week does not make up for that, right? So making sure that you get your cardio in, that you're doing that muscle resistance exercise, that kind of thing. That's important.
Yeah, for sure. What do you think about I know you guys offer it, like, the semaglutide and, like, Manjaro, whatever, like, that sort of stuff. Um, I know a lot of guys are trying to lose a little bit of weight these days too, and testosterone does help with that, like you did mention. Do you find a lot of guys are stacking that on top, or is that something that you're finding more common now as well?
It We do have quite a few patients that do that, that they'll add in the weight loss side of things, especially to get started. So then once they lose a certain percentage of body fat, oftentimes they'll stop that side of things and then, they have that momentum to keep going with uh, that increased muscle mass and less fat mass so they feel better and they can maintain that weight. But it's probably less common than you would anticipate. Like, it's not, I would say, 1 in 10 kinda thing. It's not 1 in 3.
Yeah. Do you notice that more with the ladies? Like, they're
Yeah.
taking more of it? Yeah.
Yeah, and it's also because of women's weight distribution, right?
Mhm,
So, if a guy has a bit of a belly, they call it a dad bod. If a woman has a gut on her, that's just like society says that's unattractive, right? So that's where I think it's more stigmatizing, and that's where we see a lot of women reaching out for that as well.
and then so obviously and this is more of a dad's focused podcast, but I'm sure the ladies do listen to it too. Is the muscle wasting, that women are experiencing when going on a product like semaglutide, uh, how important is the weight training for them while they're doing that? It's pretty heavy?
It's huge, right? So, um, I think that things like Ozempic, Wegovy, those GLP-1s, they got a bad rap because essentially what happens is it turns off your appetite. So people are not eating that same amount of nutrition. They're not eating that same amount of protein. And so
Mhm,
that's when we see that muscle loss. If you're still eating, right? Because the goal is not to not eat at all. The goal is to slowly take that weight off. Um,
mhm,
by getting rid of the food noise, getting rid of or controlling the portions, then we can see uh, like women don't lose their muscle mass, right? You have to maintain that activity, obviously. You have to maintain that level of protein to be able to keep that muscle mass on, has to be effort there as well.
Yeah. Okay. Good
But
point.
it's not a given side effect. That's the point I was trying to make.
Oh, okay. It's just a myriad of things. If you're not taking in proper nutrition and supplementation and working out, you can have some issues with that.
Yeah,
Yeah.
absolutely.
Yeah. I know there's that rumor, the word going around about Ozempic face and Ozempic ass. And I'm like, probably could do some squats. It might help you. So, right.
Absolutely. Like it just depends on many other factors about this success, right?
Hmm. For sure. Think we wanted to wrap up with one because we've already done an hour, and I know we're going to have Roxanne come on and talk about the nutrition side of things. But Joey, do you want to finish with your highlight question that you had me add to our list?
I already asked it earlier.
No, you didn't. No, you didn't.
What was the
You didn't.
highlight question?
If you could tell every man one thing about his health and hormones, what would it be?
I didn't put that in.
You did. Or maybe I did. I don't know. That was the last one on the list.
Yeah.
One thing about hormones, if you don't feel well, there could be a reason. And so it's worth exploring.
Mhm.
And so if we can tweak these hormones, why not?
Totally. That makes 100% sense because, like, yeah, we talked about it before. There's so many guys that walk around and they feel like in this state of like depression, but they don't talk about it. And very few men have a friend circle where it's easy to talk about your emotions and feelings and those sorts of things. And we keep a lot of guys internalized, especially in our age group. I think the younger generation is doing a lot better with being more open and forthcoming with their feelings and stuff. But yeah, I agree with that point. It's like if you're not feeling okay, one, it's okay not to be okay, but two, like there's things out there that can sure tune you up in a hurry. So, reach out to Science and Humans and get your test done, get a consult, and see if there's something that they can do to help you out.
Absolutely.
Right on. Well, thanks so much for joining us today, Bonnie. It's been a pleasure. We did an hour, and yeah, that was great. So we're going to wrap it up, everybody. Thanks for tuning in, and we'll catch up to you next time. I think we're going to have Roxanne join us and talk about nutrition. So we'll see you later.
Thanks so much.
Thanks, Bonnie.
Bye.
Thanks.